Malik Bunting is a 14-month-old boy who lives with his parents in Sea Point, Cape Town. Today he's a happy toddler, but just 6 weeks ago he was in constant pain and discomfort. He was covered in eczema from top to toe. For those who haven't had eczema or known a sufferer, it's difficult to understand how debilitating it actually is, and in babies it's even worse.
Well, he'd scratch himself a lot, and that would result in him getting bacterial infections. At one stage, he had 26 boils all over his body.
Margaret Bunting has been struggling to manage her baby's eczema since he was 3 months old. What did he actually look like from top to toe?
He was just covered in scales and, open sores. He always had infections around his mouth, his cheeks were red, blistery, and his skin would, flake off all the time. He couldn't have a bath without screaming. He couldn't, sleep through the night. He would just wake up and scream, and sometimes I'd bath him 3 or 4 times a night. But he couldn't play, do anything that normal babies his age were supposed to do, because he was always just scratching, itching, screaming.
What effect did this have on your family?
Well, we basically let the disease define our family life, because all my husband would do is go to work and, come back and attend to Malik while I got some sleep. We didn't have a life until recently.
Blood tests showed that Malik has a long list of allergies.
It's milk, eggs, wheat, peanuts, soya, fish, dogs, grass, cats.
The Buntings took their baby to 9 different specialists, trying to find some relief. They were given a variety of cortisone creams and told to wrap his limbs in bandages.
The idea around wet wrapping is to force the moisture back into his skin, and it also cools the skin, because you put a thin layer of wet bandages and then you put dry bandages, but in about 3 or 4 hours it would dry, especially now in the hot summer months. And when that happens, then the scratching would start all over again.
Tell me about some of the remedies that you tried.
I've tried something called emu oil, African potato cream, bathing him in rooibos tea, oats. Then we had the stinging nettle, which you boil. I had a homeopath in Joburg give me some drops to put into his bath. Basically tried everything, waited 2 weeks and then tried the next remedy, because everybody swore by these remedies and it had helped someone, and I was prepared to try anything.
But in December last year, things changed when Margaret was given the number of another dermatologist. Dr. Richard Aron recently returned to Cape Town after practicing in London since the mid-80s. His speciality is pediatric atopic eczema.
In the conventional treatment approach, there are 3 main items which are and can be effective in eczema, and they are steroid creams, antibiotic creams, and moisturizing creams. The trick is to get the right balance of these 3 components. If you achieve the right balance and you make the overall treatment relatively simple for the carer to apply, you can then get a satisfactory result.
So the conventional ingredients that dermatologists are using are the same as yours?
I have an approach whereby I dilute the steroid in the moisturizer according to the age, size, and weight of the child. I use it intensively in the early stages of treatment, reduce the frequency of application as the child responds to treatment, but I don't stop it suddenly. And I may continue with these dilutions of steroid cream for prolonged periods of time, 3-4 months or even longer in some cases. And it is that maintenance therapy which reduces the potential for the eczema to recur, because eczema is fundamentally a recurring problem.
Dr. Aron prescribed a mixture of creams for Malik that was made up by the local pharmacy. Margaret had to apply the mixture 6 times a day. When did you start to see an improvement?
Immediately after I'd given him a bath and I'd applied the mixture all over his body, calmed him down and put him to sleep, and he slept for hours. He slept, and he slept the next day, and he slept the day afterwards, and he just continued sleeping, and his skin gradually In terms of the way skin looked, it calmed down quite a bit, but it wasn't 100% improved immediately. But by the second week, there was an 80% improvement from what he's always been like.
There's nothing new about Dr. Aron's remedy. It contains all the same ingredients that other doctors prescribe for eczema. But the only difference is the quantity of the ingredients and the way it's applied.
I believe in using a much weaker steroid for a much longer period of time in association with an antibiotic for a very, very important reason. Because when eczema children's skin gets infected with bacteria, the particular bacterium involved is called Staphylococcus aureus. And Staphylococcus aureus has great fun on eczema skin. And what it does is it releases a poison called an exotoxin. And that poison creates havoc on the skin. It actually creates flare-ups of the eczema. So I believe that you need to use an antibiotic cream in conjunction with the steroid cream and the moisturizer, because if you eliminate the Staphylococcus aureus, you have a reduced potential for flare-up.
With his overwhelming success rate, Dr. Aron is recognized as one of the world's experts in treating childhood eczema. Now he's adding to that list of success stories here in Cape Town. Aiden Ravenscroft is 6 years old. For the first 5 years of his life, he suffered from chronic eczema, which covered most of his body.
If you get it bad, it's not so nice. I once had it bad enough that my knees were all like flaky, like the skin. It's like little cracks in the skin when you get it really bad.
Is it very sore?
Yeah. When I had it bad with all these flaky stuff on my knees, it was actually sore to walk.
Aiden scratched himself so much that his knees became raw and infected.
You know, several times a day, and particularly at bedtime and then through the night, where he would just start scratching and he would just scratch and scratch and scratch, and you'd have to hold his hands so that he wouldn't rip himself open and bleed, and then he would be wild. He would be screaming and crying.
Aiden's mother, Dr. Julia Kane, says they tried everything to find a cure for his eczema.
I have lost count of the number of health practitioners we went to. We saw sort of mainstream medical people, so GPs, pediatricians, dermatologists, an allergist, and then on the alternative side we tried countless homeopaths and naturopaths.
What impact does it have on the family and you as a mum?
As a parent, you feel completely helpless, and I mean, it's just, there's like trauma in every day. So just like bathing the child is screams and you're hurting him.
But Aiden's world changed when his mother happened to sit next to Dr. Aron on a flight from London, and they discussed his eczema.
And he turned to me and he said, well, you know what, it's your lucky day. And I said, oh, really? And he said, yes, because he stated very forthrightly that he was one of the world's experts in childhood eczema, and he was going to sort out my child.
Within 10 days, Aiden's eczema had cleared up, and today he's able to swim, play on the grass, and do everything any other little boy can. He's been clear for the last 18 months. Dr. Aron has been practicing for 43 years and says it's time to give back. He set up a consultative website which allows anyone, anywhere in the world, to get the same treatment. What drives you? What makes you want to get this message out?
I'm driven by frustration that the conventional profession is not offering patients this particular type of treatment. Part of it may be that the skills required in making mixtures, they are old-fashioned skills, which when I started my dermatology studies was fundamental to our training. And I don't think in the modern world that the new young dermatologists are taught the specifics of mixtures. And if you don't use a mixture, Annika, then you can't dilute the strength of the steroid.
Would you consider teaching your approach to other doctors?
Absolutely, yes. As long as they agreed that the principles of my therapy made sense to them.